Welcome back. Good to have you with us tonight. As COVID-19 continues to mutate and new variants are identified globally, should we be preparing ourselves for annual booster shots to stay ahead of the new variants? To talk to us about this, I'm joined now by the World Health Organization Vaccine Safety and Quality Officer in the Regional Office for Africa, Dr. Edinam Amavi, as well as Michelle Groome, head of the Public Health Surveillance and Response Division at the National Institute of Communicable Diseases. Good evening to you all, and thank you very much for joining us tonight here on In Focus. Let's begin with you, Dr. Amavi. As we are seeing more nations who are highly vaccinated as far as their vaccine programs are concerned, talking about Israel, I'm talking about the United States, more and more of them are beginning to talk about vaccines boosters. And the question then comes, are vaccine boosters necessary?
Good evening. Vaccine boosters are usually utilized in people that have immune compromission, because normally you receive your first, maybe second or third dose of vaccine in the administration schedule. But it is assumed that for people who are immunocompromised, the first and second dose may not be sufficient, so later on they receive what we call a booster dose. And that booster is to revive the immune system, because the immune system works with memory. Now, currently, WHO would probably give some booster considerations when everyone has received at least 1 and 2 doses of the vaccine, because we are managing the quantity of vaccine available for the population, and WHO is advising that the maximum receives the vaccine at least first and second dose before we start thinking of the booster shot for those who have already received their first and second dose.
Now, Michelle, one of the leading epidemiologists or scientists in this particular field, Dr. Fauci, is saying in one of the conversations that sooner or later we're all going to need booster shots. He uses a blanket kind of statement like that. But also we do know that antibody levels, for some reason, are beginning to drop, especially after 5 months of the second jab. Does the COVID immunity wane?
Yeah, so I think... Oh, sorry.
Michelle? Yeah, sorry, Michelle can come.
Yeah. So at the moment, I think there really isn't enough data to inform that. Definitely for countries in Africa, you know, we've just started giving our first, and some people have received second doses. So I think it really is too early to start thinking about a booster dose here. You know, in some of the high income countries who may have high vaccination rates, I think at this stage, I mean, you know, there's talk of booster doses, but I really think it's a bit premature in terms of vaccine equity. And so, you know, looking at the South African picture, I think we really need to look at giving everyone at least you know, 1 dose, and to get them fully vaccinated with their primary series before we look towards booster doses. And I think, you know, we've still got a long way to go towards really understanding, you know, if there really is waning immunity, when that happens. And, you know, there may be specific groups, you know, where we may get waning immunity, and there may be specific groups that we eventually may want to consider, you know, for booster doses. For example, you know, the healthcare workers, which are at very high risk, or, you know, perhaps the elderly, where there may be lower immune responses, or like the immunocompromised. But I think at this stage, we're far from thinking about booster doses.
Yeah. Dr. Amavi, you want to weigh in on that? Is there any reason why antibody levels are falling in certain individuals who've had their second jabs?
Like my colleague was saying earlier, it is very early to think that antibody levels are reducing, and so the immune system is not able to respond, because the antibody is just what you see from the immune response. The memory is not only the antibodies that are produced. So there could be some cells that will be reactivated when the person encounters the virus anew. So for now, we don't have sufficient data to say that antibodies reduce after 5 months.
So are you saying antibodies themselves, or at least antibody levels, are not necessarily the only thing that gives us immunity? I know they speak of B cells and they speak of T cells, and how do they work in this whole equation?
And IgDs, because when you encounter the virus, there is an immune response that is elicited, and this one involves cells that are producing antibodies. It involves also T cells, and all of them can go dormant cells, and whenever you encounter the same virus, they come very quickly. So at this stage, it is too early to say that the response was not good. What WHO recommends is that at least 70% of the population gets vaccinated. So the number of people vaccinated is more important in stopping the progression of the virus.
Yeah. And Michelle, what purpose then will the boosters serve for the high-risk group? And what side effects are we to expect, or what will they look like? And is there a lower or a higher risk of adverse events with boosters?
Okay, so I think, I mean, we really must bear in mind that we need to really just vaccinate as many people as possible with their primary doses. But in the event that that has happened and we've managed to vaccinate, the majority of the population, then I think we need to be looking at different potential strategies. As I said, I think the high-risk groups, I mean, the elderly for some other vaccines do sometimes maybe not have as great a response to vaccines the older you get. And we know that the elderly and age is a high risk for severe COVID. And so, there is the potential that may be a group that we would want to look at. It's unlikely that there's a risk in terms of increased adverse events after a booster dose, because what we're trying to do with any additional dose, your body's already producing antibodies, and when you either through natural infection or through another vaccine, what you're doing is just trying to stimulate the response again. So it's unlikely that we would expect, increased adverse events after a booster dose.
And as far as the variants themselves are concerned, how advanced do we think these variants will mutate, and how badly do we believe that they will be as they progress compared to the current ones that we are seeing? I'll give you both an opportunity to answer that. Dr. Amavi, you can start.
Pardon me?
How badly do we expect the variants to mutate, and how badly do we believe they will be compared to the Delta one, for example, which is thought to be quite severe?
In severity, we don't expect variants to be more severe than the present strains, but variants have tendency usually to escape the response more than the previous strains, and they have higher transmissibility, but with lesser severity. But as we know for now, we are not having more severe cases in people that have been vaccinated than in people that have not been vaccinated, and the reason why it is recommended that more and more people get vaccinated, so that the number of people that are admitted in hospitals and or die from the Covid-19 infection reduce as time goes.
Yeah. Michelle, what are the expectations as far as the mutations are concerned?
Yeah, so I think with our current vaccines and what we've seen with the current variants of concern is that the vaccines are still give good protection against severe disease. So that's hospitalizations and deaths. There are still some breakthrough infections. Most of these are mild. And so we would expect, even with new variants that come about, that the vaccines would still be able to protect against severe disease. And although we wouldn't necessarily be able to eradicate, the virus, we would be able to protect against the severe disease, decrease our hospitalizations and deaths. And I think that's what's really been putting a strain on healthcare systems, particularly in Africa. And so if we can prevent that severe disease, I think even against the existing variants, obviously COVID, we can't predict everything that's happening. But I think from what we know and with the current variants of concern, there's still good protection by the vaccines.
And now, the other question I suppose many people are asking themselves, depending on vaccine availability, if I had initially gotten a Johnson & Johnson vaccine or I had gotten a Pfizer vaccine, will it make any difference if I get a booster shot coming from the other brands of vaccines that are available? Michelle?
Yeah, so I think we also need to wait for data. I mean, there are some studies looking at these mixed schedules. I think what happens once vaccines are in routine use, you do get these, scenarios where, due to vaccine supplies, maybe you get a dose of a different vaccine. And so it would be important to have a look at that. And as I say, there are some clinical trials looking at that. So I think we really do need more data. I think there's a lot of different scenarios. There could be someone who's received a vaccine and then got natural disease. There's people that, may have first got disease and then got a vaccine. And so at this stage, I think still a lot of data needed in terms of, whether there's any benefit of getting vaccines of different types. So say a vector vaccine with an mRNA vaccine. So, I really think this is a new virus. These are new vaccines. And I think there will be a lot of data generated in the coming months that will be able to guide us.
And finally, Dr. Amavi, have researchers fully explored how the current cocktail of vaccines we have work and how safe they are?
I'm sorry, the volume.
I'm saying, have researchers fully explored how safe the current cocktail of vaccines are? I'm talking Pfizer, Johnson & Johnson, Moderna, and AstraZeneca. And, of course, the Sputnik 5 and the rest.
The WHO EUL program is to make available for emergency use any products that have proved safe. So there have been clinical trials that were conducted, and the clinical trials continue, and their objective is to assess safety of those products. So it's because they have not shown any concern that they were approved. There are many more vaccine products being tested, but those who have received the emergency use listing have proved safe. And the countries have pharmacovigilance systems that are monitoring on daily basis any adverse event that may occur to provide care, because when the real problem comes when the adverse events are not treated early enough. So there are systems to detect them early and provide care and continue to monitor based on data if the safety profile of the vaccines that are being used currently is still good or not. And besides that, the clinical trials continue. Those of them who are in phase 3, they continue their clinical trial, besides the fact that it is being listed for emergency use.
Ladies, I appreciate your time. Thank you very much for joining us tonight. Dr. Edinam Amavi from the World Health Organization's Regional Office for Africa, and Michelle Groome of the National Institute for Communicable Disease.